This podcast is for educational and informational purposes only. It should not be used to substitute the advice from your medical professional or primary care provider. If you are having any kind of medical issue or emergency, you should call 911 or go to your nearest emergency room, urgent care center, or consult with your doctor.
Welcome to Healthcare Snitches. Hey guys, welcome to Healthcare Snitches.
Welcome. Episode
19. We know today.
Yes, we do know today because we went through and we counted, and we're gearing up for episode 20, which is going to be special. But before we get into all of that, I wanted to remind you guys to like and subscribe to our YouTube channel, Healthcare Snitches. Turn on your notifications so that you get notified when we post new episodes to YouTube, Spotify, and Apple Podcasts.
Yes. And please ask us some questions so that we can talk about it when we come here. You guys don't like it when you watch it. You don't ask no questions. You don't leave comments. Are y'all dead out there or are you alive?
Right. Are you watching? Are you...
Somebody's watching.
Right. Because like we say, tell your mama, tell your father, tell your mailman, tell your doctor, tell your dentist, tell your podiatrist.
Your connect.
Not the connect, the kid. Your dog, tell your...
You said tell the dog?
Yeah, tell your veterinarian.
Yeah. Corey was doing something the other day where she had her fake live audience watching her, and she was like, y'all need to be watching Healthcare Snitches.
Yes. That baby promoting us. I love it.
So today's... Can you guys hear me? My bad. So today's topic is going to be, Jasmine titled it. Should we tell them what the title is?
Oh, Unbig Your Back?
Yes, it's called Unbig Your Back. We are going to be talking about bariatric surgery and the different types. And we are going to have a special guest.
So, yeah. We're going to talk about GLP-1s too a little bit, but just like mentioning them.
So our special guest today is Jasmine.
Hi.
So I'm going to be asking her a few questions, just in case there's anybody out there who has been thinking about bariatric surgery, who has tried everything and nothing is working for weight loss. And she may be able to give you some info that you might need to hear.
Yeah.
Right?
Yeah. I mean, firsthand experience over here. Struggle is real and kind of took care of that.
And you look fabulous, by the way.
Thank you.
You really, really
I
do.
feel good though, which is like everyone sees the physical manifestation of the process, but I feel much better within my body. Like
I'm sure you do.
In my body, moving.
Mentally too.
Mentally. It's been a whole transformation. So.
And when was your surgical date?
September 22nd,
2023. I don't be forgetting none of your dates. None of your important dates. I really don't. Yes, September 22nd, 2023. So it's been a year.
Yeah, it's been a year and a month. So about 13 months now. And I've lost a little bit over 100 pounds. So almost 110 pounds. And counting, because you can still, lose weight up until about 2 years. So I'm still in the weight loss phase right now, but it's definitely slowed down from the beginning.
Where it was like rapid.
Where it was like really quickly.
Well, you were hanging by a thread as well.
I was hanging by a thread.
You had one pinky toe in the hospice.
I did.
Yeah.
I did.
She did. So who wanted to eat during that?
Huh?
You were on a struggle bus trying to get your protein in and stuff. You wasn't really trying to eat like that.
I wasn't. I was just trying to, at that point, not vomit and stay hydrated because dehydration can really take you out. Also, there's vitamin deficiencies that come with having these types of surgeries, so you really need to stay on top of that. I've heard of people ending up in wheelchairs because they had a vitamin B1 deficiency, which causes neurological issues.
So they were permanently in a wheelchair?
No, just maybe for like a year. And that's really hard to reverse. So, people think having this surgery is the easy way out.
It was nothing easy watching this.
Was the hardest thing, probably one of the hardest things I've ever done because I did it properly. Now, you may talk to some other people who feel like, oh, I just had the surgery, I lost the weight, and they were not following the process the way they should. So maybe they didn't lose as much weight as they could have, or they did lose the weight, but they look like saggy, or they look like they have vitamin deficiencies. Yeah. Or maybe they look like they need to drink an Ensure, like my mom said.
I remember a few times I came over here and you had an IV pole connected to you.
Yeah.
She had to get a visiting nurse service to come and give her fluids. That was the beginning. It was rough.
Yeah, that was the beginning, and I had to have that whole line placed in my arm. Child, I said, I just be fat because this ain't.
You be fat and happy.
Right, because I was not saying I was just fine, but I didn't have to go through all of that. But if there's one thing that I know and that Kim also knows, if you're having any procedure and there's like a 1% or 5 or 10% chance that this X, Y, or Z can happen,
it's going to happen to us.
We're going to have it. And so that is not typical. It is common for people to need fluids after the surgery. But for me, I was really not able to, I was having like spasms in my stomach. So I wasn't able to like consume water or anything really for a while. So I had to get my fluids in. So
you could barely drag the IV pole.
Yeah, I could barely drag it. It was bad. But I'm here.
And you look fabulous.
Thank you.
Yes, you do. Girl, you here to tell your story.
I am here.
All right, so tell us about the different types of gastric surgery.
All right, so the most common one is the vertical sleeve gastrectomy, which is sometimes it's just called the sleeve. Mm-hmm. Sometimes it's called VSG for short. So you'll see a lot of people get that because it is, even though you are removing 80% of your stomach, mm-hmm. So the organ of your stomach, you're removing 80% of it. So your stomach is normally the size of a football, mm-hmm. and they are taking it down to the size of a banana. So if that gives you any indication as to how much they're taking out.
That's a lot of stomach.
That's a lot of stomach. It's most of your stomach. They say that they remove the part that regulates the hormone that controls your hunger, which is also supposed to help. But I'm going to tell you right now, after,
I know what you're
even though I couldn't eat after the surgery, my stomach was actually, like, before the surgery, I wouldn't really get hunger pains unless I was really hungry and I was starving. After this surgery, and I'm talking like the day after or two, I started getting hunger pains. I was like, you know what? They lied. I said, I want my money back.
You wanted like a Big Mac.
I did. I was like, they lied about this because I'm definitely still hungry right now. Like, who all over there? And I wasn't hungry like this before.
Maybe it's because you knew you couldn't eat.
No.
You was really hungry.
Because, I go through things where I haven't been able to eat, like being pregnant. I can't eat during that time. And I never felt hunger pains like that. But so if you are still hungry after this surgery, just know that it will still work for you. It's just, I don't know, maybe that part wasn't removed, or maybe I don't know what activates.
So let me ask you something, so that our audience can understand better. So they take out 80% of your stomach, right? They get rid of it. And then is there like a sleeve that goes over the portion that's left?
No. It's just that the part that's left, that is like the banana shape,
that's considered like a sleeve.
Okay. That's why they call it that.
Okay. See, if you don't ask, you won't know.
Right. You can go to other countries and get like a mini sleeve where they don't take out as much.
Maybe like 60%.
Right. They'll do like up to 50 going up. Because if you don't remove at least half, it doesn't make sense to do the surgery. Like, you might as well just, I don't know, stay the way
So they don't do that in the U.S.?
They could. Like, you could talk to your doctor about it. But if insurance is covering it, they're going to want to make sure that it works. And so it's not like they're going to be like, oh, let me go in there and do 65% and then we'll see how it goes. No. They're going to take out what they can take out.
Okay. You just said something about insurance, and I'm going to write down a question because I want to come back to it later. I'm going to take you off your track right there.
All right. So you're going to get the most information in this episode about the sleeve because that's what I had. The other ones I'm familiar with because of different support groups that I'm in, but I didn't have them, so I can't really speak firsthand on recovery from it. Like, I did my research because I knew this was the one I was getting. On the other ones, I didn't do as much research because I wasn't getting them. I think the second most popular one is gastric bypass, and that is pretty much where they rearrange some guts. That sounds horrible, but
and they also decrease the size of the stomach too.
That is what I had asked you to look up. That's why.
Oh, did you?
Yeah, remember I said I didn't remember? Now I remember. All right, so let's just talk about this really quickly. So gastric bypass is when the stomach is divided into a small upper pouch and then a much larger lower remnant of a stomach. So they got to create something. The small intestine is rearranged to connect to both.
So the hip bone connects to the knee bone.
Right. So they actually doing some rearranging in there, whereas the sleeve is just like they remove the part of the stomach, everything else stays intact. I think of it as like none of your plumbing has been switched around. It's just they're making your stomach smaller. But with gastric bypass, they're actually moving things. And so you'll see a lot of people have issues down the line with like bowel obstructions.
Oh my God.
Strictures and things like that.
What?
Because they're moving stuff around. But
that doesn't sound like a good route to take.
I mean, you sometimes have to.
That sounds crazy.
Usually bypass is recommended for those who are severely obese, though.
Oh, so like 1,000 pounds sisters, like big girls. Like I'm 600 pounds and I'm stuck in a bed.
Yeah, but sometimes if you're too if your BMI is way too high, they will do the sleeve on you first, so let you lose some pounds, and then bring you back in to do the gastric bypass.
Let me ask you something. TLC. Dr. Now.
Dr. Now.
Which one does he normally do?
I've seen him do both.
Okay.
I've seen him do a lot of the sleeve first and then bring him back in for the bypass. Dr. Now is rude, but I mean, I guess
is he rude or is he the truth?
He's a little bit of both. Like
he is.
He done told people you ate all you've needed to eat for the life. Come on, man. We're not bears. We don't store the food like that.
Like, people will be like, I'm going to be hungry. And he's like, you've eaten enough for the next 4 years.
Exactly. You've eaten enough for all of us in this room.
Yeah. He is rude. I actually did a little research on him, and I saw that that his wife divorced him. I said, I wonder
probably because he was rude. He probably locked the fridge up and said, look, first of all,
he's not even a slim.
Exactly. This is what I was about to say. Dr. Now, looking like a little round thing over there. Right. Look like you need to follow your own advice, okay? I'm just going to leave it at that.
He does.
But what's up with these bariatric doctors that look like they need to go on their own table?
I would not trust a bariatric surgeon operating on me and he looking like Heavy D.
Right.
I'm just not gonna.
Right. You looking like you ate a few breakfast sandwiches and you need to unbig your back before you came here. But yeah, you gonna cut me open. I mean, I'm fine, but also, don't tell me about myself. Okay.
That's like I'm not going to call his name, but one of the endocrinologists, he has diabetes, and his A1C is crazy.
Well, clearly he's not following his own freaking advice.
Exactly.
So how can you treat me if you're not even doing it?
Makes you go,
I'm not going to a dermatologist with acne. I'm just not.
Not you not going to a dermatologist with acne. What if they have tried everything for them and it's not working for them?
I don't know. Then quit dermatology because it ain't your strong point. Right?
Listen, we go to psychics, and they supposed to be so psychic, but they can never figure out the winning lottery numbers. We still go to
right, and they life be in shambles too.
Right? They couldn't predict
you ain't see that coming. All right. Well, so you have gastric bypass because we're gonna get through this because I feel like our questions are gonna take up some time. And then we have the gastric band, which is not really performed as much because of infection rates and failure. Like when I went for my consultation, that was not even offered to me. It was the sleeve or bypass. Like those are going to be your offerings.
Mm-hmm.
And then also it really depends on what your insurance covers too. So all those things need to be factored in. There is a newer procedure called the SADI, and that is a combination of a bypass and a sleeve, and they do something else with it.
A bypass and a sleeve?
Yeah. And they also rearrange the guts a little bit differently.
Oh.
And then they have this gastric balloon, which I kind of had looked into before I got this surgery, because I was like, well, maybe I could just get the balloon real quick, lose the weight, and then get it out.
That sounds band-like. Is the balloon around the stomach, like how the band is?
No, it's something you swallow. So that was my first inclination. I wasn't gonna fucking do it. I didn't mean to curse. That I wasn't gonna do it because, you go in, you have an endoscopy pretty much. They put it down in there and then they inflate it, and it takes up most of the space in your stomach. So then, you go about your life.
How much you can eat.
Yep. And you have it in for like 6 months to a year. It does the restriction, and then they take it out.
Oh, it sounds like it's minimally invasive.
It is minimally invasive.
They don't have to cut you. Endoscopy.
They don't. Yep. And it's new, and they've been doing it in other countries, but it's not covered by insurance like that. So that's where you're going to run into your issue, because it's new and it's experimental, and we don't yet know the effects that it would have.
It came out in 2024. That's how new it is.
I don't know when it dropped, but it's definitely within the past few years.
I want to see the gastric balloon cost, because now I'm wondering.
But what they say is that a lot of these GLP-1s are going to put these things out of business. But my opinion, because just as an FYI to y'all, I had tried to get Ozempic and such, whatever, semaglutide, tirzepatide, all the tides. But under my insurance plan, they were like, nah, we're not covering that. So it was going to be like $1,500 to even get a monthly supply. So I said, you know what? No. And they wouldn't cover it anyway. So it was just a double no, but they would cover this surgery. And for me, I felt like it was more of a permanent solution, since weight loss has been a struggle for my whole life. I didn't really feel like the Ozempics and such were going to work for me. I feel like they would have worked for me, but I wanted a more permanent solution, as opposed to something that was just going to work for the time being, and then I have to worry about
excessive weight gain when you got off.
Exactly. Which
it says that the average cost of the gastric balloon surgery ranges from $6,000 to $9,000.
Oh,
so if it's not covered by insurance, then
did you see there when it came out?
Oh no, I can ask that,
because my only fear with that is because it's newer, we don't really know how effective it is, what the side effects are long term. These other surgeries that I've mentioned so far, the sleeve, and especially the sleeve and the bypass, have been around for years and years. And so there's way more research and statistics on their effectiveness and everything else.
So it was actually introduced in the United States in 1985.
Oh, so it's as old as me.
The FDA approved it for temporary use as a weight loss device, but it was withdrawn from the market in 1992 due to complications and limited weight loss.
Mm-hmm.
So then the FDA approved the first gastric balloon devices again in 2015.
Mm.
So there's a few different ones. So 2015-ish.
Yeah, again, insurance is not covering it. I don't see many people getting it.
Yeah, and especially if it failed the first time around.
Damn, in the 90s, they were trying to do everything. Yeah. And then there's a duodenal switch, which again is rearranging some guts.
Ooh, 1111. How's it, people?
Yes. So those are the different types of bariatric surgery.
All right.
All right. Let's.
All right, so let's start the interview process.
Yes.
I'm Oprah. She's
Special
Gail.
guest. Yes, but I'm also me in this too.
All right, so I want to know, what weight loss tactics did you attempt before deciding on surgery? I was here for a lot of them, but a lot of it I wasn't here for.
Okay, so I know this is a question that you have, so I'm gonna answer the second question first, so that
should I ask this?
So that I can line them up for you all.
Okay, so the second question that I have is, how old were you when you first attempted weight loss? So she'll go into both.
Yeah, okay. So to start with that one, I was about 10.
Why were you 10 caring about your weight?
I didn't care. I didn't care a damn thing about it because I was just 10, being a kid trying to live. But when you grow up with a highly critical West Indian mother, as soon as you start to look a little bit like something, right? They're like, you're fat. So,
were you a big girl at 10?
Yeah.
How much did you weigh, if you
I
had
have
to guess?
no idea. Probably like 1 something.
Oh, wow.
I don't know. I don't remember. It had to be around 10 or 11. I was always tall. I was always taller than everyone.
Mm-hmm.
And I would say, based on like my father, my grandma on his side, my mom is shorter, but she's like thicker. Mm-hmm. She's not, I wouldn't consider her to be fat at all. But
no,
I think
she's not fat.
Genetically, I was just predisposed to being, big. So yeah, it started around then. And also, my mom doesn't have the best, sorry if she watches this episode,
delivery?
Oh, no, she doesn't have the best delivery. But what I was going to say is eating habits, right? So one thing that runs in my family on my mom's side is diabetes. And it's not because, I don't even know.
So you wouldn't say that it's genetic, but more environmental?
Both.
Okay.
And so looking back at some of the foods that she would buy, because obviously at 10, I'm not going grocery shopping. I don't have money and I don't have a car. So I eat what's available to me. Yeah, I wasn't, no, it wasn't.
So when you say that you attempted to lose weight at 10, excuse me, was it her saying, okay, let me change the food that I put in this house for these kids, let's try to eat better? Or was it you as a 10-year-old child with a 10-year-old brain trying to cut down on what you eat?
It was me more so trying to cut down, but also I would say probably around like 12 is when she started taking me to places like LA Weight Loss, which was like a weight loss place.
Really?
Yeah.
I remember LA Weight Loss.
Yep, I tried that.
At 12?
Mm-hmm. I tried, mind you, throughout all this time, I was very active. I played sports. I was active at school. I wasn't sedentary at all. Mm-hmm. It was just, again, I think for all my life it's been genetic. Because I've been in company of people where we eat the same thing or they eat worse than me. And I'd be,
so your metabolism was just different.
I believe so.
Do you feel like, if you could close your eyes and look back, do you feel like you were like a sloppy, chunky something? No, I was never that. So you were personally comfortable in your skin at the age of 10 and 12. You were comfortable.
I was fine.
But she made you feel uncomfortable.
Yeah. And of course, kids are not nice. So.
Oh, so kids teased you too?
Yeah. Absolutely.
Yeah. That's awful. Kids are cruel.
They are. But, whatever. And so going through all the things that I tried up until the point of this surgery, LA Weight Loss, Weight Watchers.
I remember that.
Herbalife. I tried that probably like in high school.
Okay, because I was going to say, I don't remember that.
Weight Watchers. I tried that several times. Keto.
I remember that. You almost died.
Yeah.
A few times.
Intermittent fasting.
I remember that.
Metformin.
I remember that. Exercising until you were drenched in sweat daily.
Just plain diet and exercise. Low carb. So not keto, but just low carb. No carbs. All carbs. Water, lemon, cayenne pepper. And
I remember that. You ever did the Atkins diet? That's that meat focused one.
No, I didn't. I can't say that I did.
Okay.
Because, like, I can't say that I did.
Okay.
What's the other thing where so not Weight Watchers. I don't know, y'all. There's been so many things that I tried. Phentermine. Okay. So,
was I here for that one?
yeah, that was like right before I did this.
Oh,
that
yes,
was right before
yes.
the metformin.
Yes. I remember.
Okay.
I remember.
Phentermine. Oh, there was a time where I had tried these shots. It wasn't GLP-1s. It was just like B12. It was supposed to help and do a few things. That was, a while ago.
Damn, you've done a lot.
Yeah.
Now, out of everything that you named, minus the surgery.
I feel like I tried Hydroxycut too at one point. That was probably high school.
Damn. Out of everything that you've done, minus the surgery, was anything really effective where you saw a big result?
No, not at all. And I mean, with being,
it was like,
I'm a consistent person. If you tell me I got to hop 5 times and do the X, Y, Z to lose the weight, that's what I'm going to do, right? And I'm going to give it time to work a little bit. And then so that I can actually say, like, this either works or it doesn't work. I'm not going to just be like, oh, try something for 2 weeks and then be like, nah. No.
You give it your all.
You have witnessed me doing this and nothing happening, okay? So I don't know later on in life whether it was like hormonal or what have you, but none of the things that I just named have worked for me. The only thing that worked for me, to the point where my own sister was like, did you have bariatric surgery? Was me being pregnant. Okay. So when I had my first pregnancy, I lost like 60 pounds.
You was looking like a crackhead.
Yeah.
Your clavicle was showing on your neck.
Yep. So my first pregnancy, I lost 60 pounds. And that was because I literally was throwing up, could not eat a thing, dry heaving everywhere for 9 months. Okay. Second pregnancy, I lost even more weight. That's when my mom and Mo tried to give me Marmite, which, if you don't know what that is, maybe you want to look into it, maybe you don't. But it's supposed to help you because that's how sickly I was looking. All right? So basically, the only other thing that worked for me was starvation, which depleted my vitamin sources, and
you became
malnourished. So it wasn't a healthy way to lose weight. And obviously, after all of my pregnancies and getting older, gained all that weight back anyway.
Once you dropped them babies.
Yeah, but that took me like probably 10 years to slowly gain that back over time. But all of these attempts were over the course of my life. So since like 12 was over the course of my life. So my weight has fluctuated over that time. And having this surgery has been the most weight that I've ever lost. And so it's been a year. So I can't necessarily say I'll come back, but really for me, the testimony will be if I can keep it off for 10 years or something like that. For me, that's
thus far though, it has been the most successful.
It has
from surgery to date.
From surgery to date.
And from consultation to date.
From consultation to date, and it's been the most consistent. So previously it was just kind of like, oh, okay, I lost it because I was pregnant and I couldn't eat, but now I can eat again, and now we're back to the show.
Yeah.
But this is a more permanent thing, so.
Okay. And based on your experience of this surgery, if you had to, would you do it all over again? And that's taking into consideration your near-death situations. Like, I'm just going to put your business out here. Like vomiting and recovery. Because me and Jasmine don't vomit. Like, we rather get shot in our pinky toe.
Yeah.
So that right there made you rethink your whole life.
Absolutely. The next day when the surgeon came to see me, I was like, yo, can I get my stomach back?
Right, because I'm not going to be doing this. I'm not going to be doing this.
Yeah, I don't really like this. I said, why did I do this again? Because I could have been just fine. Eat my cheeseburgers and
drinking wine.
Right. Drinking wine.
Eating pork bacon.
Right. Because that's what I wanted to do anyway. But now I'm here throwing up and shit, and y'all said I would be fine, and I'm not.
And didn't either you or Jamie told me that one of the nurses was like, is she in there throwing up? Like as if it was something that they're not used to people doing post-op.
No, somebody in another room down the hall was like, ew, because it was so loud and it was so violent. Because number one, I'm not used to throwing up because I don't be throwing up like that. And number two, it was disgusting and it hurt.
That's because they had you drink the stuff when you went to go. Mm-hmm.
So I had to get it out, but it didn't sound good. It was violent. So not only was it wasn't a calm regular throw up, it was a retching. Okay? A retch.
That's how Corey throws up.
And it hurt.
And you really didn't have anything on your
I did it
on your stomach, so you were possibly even throwing up bile.
Yeah.
After it came up.
It was whatever the flip they had me drink.
When you throw up bile, it's very violent.
Yeah. It hurt. Because I still have stitches. I mean, obviously it was that day. It was a few hours after the surgery.
Hours.
Yeah, I still had, stitches were fresh. The 80% of my stomach being out was fresh. So the internal and the external stitches. It was a hot mess.
Would you do it all over again?
Would I do it all over again? Yes. And
you're savage.
To add to this, I would also have done it probably in my 20s as opposed to being almost 40 and doing it. Only because at that time I could have qualified for it, but I just wasn't.
You didn't think about that, right?
I didn't think about it. I wanted to. There's a certain level of ego and pride that people have where they feel like they want to do it on their own, and then they'll feel better about it. I don't know. My outlook has completely changed on that because I tried to do it on my own multiple times in multiple different ways, and my body was just like, "Nah, girl. Like we like you like this. We don't want to be like you. We don't want to be skinty."
You know what that reminds me of? Like people who say they don't want an epidural, they just want to go natural, and does that make you better? These kids will be fine with a little bit of medication. Right. They'll be fine.
Exactly.
Little fentanyl ain't never killed nobody.
I mean, it has, but
but that's what that reminds me of.
Yeah.
But at least you did attempt to do it on your own. Yeah. And as you shared with our audience, you attempted multiple ways. And I've watched you do a lot of them, and you were so dedicated. And you also put in exercising.
Yeah, like I've always liked to exercise. I don't really get to that much, as much as I would like to.
Well, you go for your multiple walks a day and stuff.
Yeah.
That's exercise.
It is, but it's really disappointing when you try all these things and you don't see the results. It makes you feel like is something wrong with me? So that's why I did go through going to the endocrinologist to just make sure that my hormones were okay. He couldn't really find anything definitively, but definitely that I have PCOS, which impacts several different things. Never really impacted my fertility, but it impacts me and my insulin and the way my body processes insulin, which I think has to do with the reason why not only I can't lose weight, but also it's hard for me to keep it off. Or it's historically been harder for me to keep it off.
Did they also check your thyroids? I'm sure they did.
Yes. Mm-hmm. I had that ultrasound and everything because he felt like he felt something, but then it was nothing. Thank God. But
your mic is standing up straight. How did you do that?
I don't know.
It's like standing up straight, like it's an invisible man sitting there.
Took some Viagra before this.
Okay. What was the hardest thing you endured during this entire surgical process? And be honest. And if it's more than one, share it with us.
I would say right after the surgery. So, okay, before the surgery, you have to do a liquid, depending on your doctor. But for my surgeon,
you answering the next question. All right, I'll tell them what that question is too, so that you can answer both of them.
It's a process.
What is the pre-surgical process like?
Yeah, but
you could put both of them to you could answer both.
I can't. Let me focus on what's the hardest so beforehand you have to do this liquid diet. Not everybody requires this, but it's to shrink your liver because the liver and the stomach are very close together. And if your liver is fatty or if your liver is inflamed or larger, then it's harder for them to get to the stomach to do the surgery. So that's why they have you do that pre-op diet.
And you tend to lose weight during that.
Yes, even though I only lost 7 pounds during that time, but it was a week. We won't talk about that.
Right.
But
you started off wrong.
I did. Mine was a week, and I feel like that was hard as hell. So they make you do like protein. You can't have any food for my surgeon. Some people can have one meal. Like they do the protein shakes, clear liquids, Jello, and then you have one healthy meal of protein and veggies. I've heard of that. But for my doctor, they're like,
liquids only.
They said no. Some people have to do 2 weeks of liquids only.
I think that's what my cousin had to do.
Yeah.
2 weeks.
We went to the same surgeon, so I'm good.
But I don't know if y'all had the same procedure. Did you?
I don't know what she had. All right. Yeah. So I would say that was so hard because I still had to make dinner for my kids. I still had to be around food and people. I was very angry.
I was very
angry. Okay. I would go to work and my boss would be eating like a whole it got to a point where she started apologizing. And I don't know, it was a thing. It was more psychological than anything else because the thing about having to cook for other people in that time frame is that you are used to chewing, you are used to eating. Digestion starts way before anything hits your mouth.
Way before you take a bite.
And you quickly realize this when you can't eat.
So you were salivating.
Child, when I tell you everything was gearing up to eat when I was cooking that food.
I would have licked that meatloaf so fast.
When I tell you, remember when I texted you like, girl, I cheated. I ate a bite of chicken. But some people were eating whole meals and shit before. They're like, I couldn't do it anymore. I didn't do that. I did take bites of chicken here and there. But I stuck to it for the most. I really did stick to it. That was hard.
Yeah.
Because there was nothing restricting me then. There was nothing to be like, oh, don't have it. You can't have.
Like, because you still had your whole stomach.
I still had my whole stomach. I was still me. And then I would say post-op, yes, because you had the surgery, that it was physically restrictive at that point. And so it was a little bit easier to do it, but it was still hard mentally because, again, still had kids. I had, I will say, I really do appreciate you and Jamie because you both were
Jamie first.
Yeah, but
she was your kid.
Remember you came over and you did get Chick-fil-A. But y'all were respectful. You ate it in like
and I brought you ice or something.
You did. Chick-fil-A. You guys ate it in like a separate room. It was a whole thing, and I was like, oh, I love them, like, because I've read stories in these groups that I'm in of people and their friends just being like eating whole pizzas in front of them. They really weren't caring. Not nice. And honestly, like I said, it's more psychological because like I don't gotta eat pizza. I just know I can't eat it, and so because I know I can't eat it, now I'm smelling it. Digestion starts before anything hits your mouth. You're seeing it, you're smelling it, like all of your senses are connected.
Your saliva is
gearing up.
Yeah.
And so I really, really appreciated the fact that y'all didn't just come up in here trying to like being like, hey, I got these chicken tenders and this sandwich that I know you love pre-op.
That is like when a person is in labor and then you eat in front of them knowing that they can't eat. Boo ate plums and a peach in front of me when I was in labor. I was so freaking mad.
Mo ate a cheesesteak. I'm like, go on ahead and get this baby out of me so I can partake because that's what you're not gonna do while I'm over here.
That is not nice. Or like if you are going with a person who has to be put under for some type of surgical procedure, and on the way you stop and get a bacon, egg, and cheese roll and coffee, like that's not. You can eat while I'm in surgery.
Right. Or if you're with someone who, you know, is alcoholic and they're like a new...
Oh my God, yes. And then you have alcohol
in recovery and you're like popping bottles. It's not supportive.
Yeah.
We're not going to say don't live your life, but it's not supportive. It's just not. Like, you know what they went through. So I really do appreciate y'all and the fact that you were supportive. Unlike someone that I know that came over and asked me to order them food saying how hungry they are.
I remember that.
So I would say that was...
Those were
the two hardest things.
Pre-op and post-op.
Yeah, just not being able to eat, like, just not being able to eat. Being on those liquids. And
having to take care of your kids and feed them.
Yep, having to take care of them, feed them. There's something about missing being able to chew and just feeling full and feeling like you exist.
So maybe you want to share with them really quickly what your steps were as far as you getting to solids. Like you were on liquids and then that was hard for you too.
Yeah, so for the first, I think it's 3 days, you have to be on clear liquids only. So that's water, and they give you like these little medicine cups where you're supposed to drink like 4 of them within an hour, I think.
Which you were not able to do.
No. So clear liquids for the first 3 days. So that's water, Gatorade Zero, anything without sugar, sugar-free popsicles, too, right? Watered down apple juice. Well, nobody told me that, but I did that because I was the only one. What else? Yeah, that's first 3 days. Soup, so like broth, you could do that. Then from day 3 on, you can move on to more creamy liquids. So you can have protein shakes now. What great fun.
You spent $1 million on these shakes and all this other stuff. She would spend $1 million, drink a sip, and be like, I don't like this. After she bought a whole case of it.
Yeah. Unfortunately, yeah, because sometimes it would just be like that.
Yeah.
I was having a lot of stomach spasms afterwards. So I would literally take a sip of something that I was able to consume pre-op. Post-operatively, I'd take a sip of it and my stomach was like, nah, girl. It would just start like, I feel like something was wringing my stomach out. So I would have to I went to the doctor and I was like, yo, this hurts. Like, this physically hurts. It's not just that I don't like it. Right. It hurts.
Yeah.
So, it was really weird. I typically like my drinks ice cold, like pre this surgery, like ice, just like, I couldn't do that because you could feel everything and it hurt. So most of my drinks had to be room temp, or just like a little, I know, and just like, that doesn't help me. And then the protein shakes that I was drinking, pre-op, my stomach was like, nah, bitch, we don't like this.
So with the protein shakes, because you said like creamier ones, is that where the cream of wheat came in?
Oh yeah, because now
that wasn't working for you either. Too tough, right?
No, cream of wheat. You could have cream of wheat. You could have like creamy soups at that point. Mm-hmm. And that was working for me for a little second. Like, I was on a whole clam chowder thing, which my nutritionist was like, "Girl, no."
Basically. But you had to get something done,
right? And so that worked for me for a little bit. Tried different soups,
and then from there you went on to purees.
Yep, from there you can go on to purees. I don't remember the exact time frame, probably 14 days.
So you can't puree a Big Mac and fries?
I mean, probably once you're on purees, you can, but I'm not going to tell you that it's going to sit well. Okay. Because when I tell you right now, the first time I tried to eat a scrambled egg.
That's when you was really sick after?
I almost died. Mind you, I had eaten eggs every day prior. It was one of my main staples.
And you found out that's why your cholesterol is high?
No. You had to put my business out there, though.
Didn't we talk about it?
We talked about it before we started recording.
Oh, before the recording. Okay. My bad. Mm-hmm.
Yeah. So, it's okay. But no, that's not why. Because there was a time where I couldn't even do that post-op. And it was still high. Okay. And they say the eggs don't contribute to that anyway. It's different type of.
It's funny because when my cousin had her heart attack, they told her stop eating 2 boiled eggs every day.
Damn.
Mm-hmm. Okay. I'm not gonna put her name out here, but you know who she is.
Mm-hmm. So, what did you ask me? What was that answer?
You was telling us what you could eat.
Oh, I had a scrambled egg, and it almost took me out here. So I stopped eating eggs for months. Okay. And that was because you go from pureed food, which I'm not a fan of because I'm not a baby. So I just stuck to soup and protein shakes. Well, the ones that not a lot of protein shakes. I stuck to soup, applesauce, and soup pretty much, and string cheese. So from purees, you can move on to soft foods, which are like the scrambled eggs. Mm-hmm. You can do like,
is that when you did
fish.
The meatloaf?
That's when I did the meatloaf. I did salmon. And you just have to chew your food up really, really, really good. Like, one of the things about the surgery is you have to chew your food a certain amount of times. My program was like 25 times or 26 times.
Oh my God.
So I had
the little tiny bites?
Yeah. So I had started to practice that before my surgery when I was in Jamaica chewing down jerk chicken. I was like, let me count this in between the rum punch and the Jamaican jerk hut that we kept going to. And so yeah, that's what I was doing at that time. I said, let me chew this jerk chicken 25 times.
I can't. So how did that feel?
It felt like a lot because a normal person doesn't think about how many times they're chewing their food. You just don't. You put the food in your mouth, and I'm gonna venture to say that most of us don't chew our food enough at all.
I'm sure.
Because again, digestion begins in your mouth. Really, chewing.
Yeah.
Chewing to swallowing to then getting to your stomach.
Okay. You already answered this before. How much weight did you lose when you were speaking? You said almost 110, but do you want to address your BMI, what it was before and after?
Yeah, so I've lost 109 pounds to date. So I'm still in the losing phase right now. It definitely has slowed down though. But I think even more so, like my BMI went from 40 to it being about 25 now.
That is amazing.
Yeah. I have also lost a lot of inches. I can't tell you guys exactly how much. I need to measure myself. I did take measurements beforehand, but I would like to do them like this week so I can tell you all like around my waist, around every how much.
Do you still have any of your like work skirts or work pants from pre-op?
Yeah.
If you put them on right now, I'm sure another person could fit in
Yeah.
there with you.
Yeah.
Oh my God, that's crazy.
That is.
Wow.
I've had to get rid of most of my clothes though. So
okay. You already answered what's the pre-surgical process like. So
not really. So
no?
Okay, so let's go back to that because I think that's a common question. So physically, you have to do the pre-op diet depending on whatever your doctor or your surgeon requires, right? So that could look like a liquid diet for 2 weeks with a meal, a straight liquid diet for 2 weeks, a liquid diet for 1 week with one meal, or just straight liquid. Mine was straight liquid for a week.
I think also, Jasmine, it probably doesn't just matter who the surgeon is, but probably the patient's situation too.
Yeah.
Right? So that surgeon probably applies different diets to different people, right?
Sometimes
based on
I think if you're
situation.
morbidly obese, you're gonna have a
2 week.
I don't know. It depends on the surgeon because they like to just keep it blanket. Because the whole point is, the thought is that your liver is inflamed and you want to shrink it to make the surgery as safe as possible. That's really the point of it. That's the only point of it.
Mm-hmm.
So the idea is that if your BMI is so high, maybe your liver is extremely large, so
fatty.
You'd have to do a longer liquid diet. But if your liver is not, then I don't know. But then sometimes they just keep it the same for all of their patients because they don't want any issues.
Okay.
All right, so physically, that's the requirements. For insurance purposes, you're going to want to check with your insurance to see what they require you to do. Because for me, they had a 3-month waiting period. And within those 3 months, I had to have, obviously, the consultation with the surgeon. They had to put in the recommendation. I had to have a psychological evaluation, which is a part of this. I had to also meet with a nutritionist, and I had to have like some type of ultrasound on my legs or something like that.
Your legs?
Yeah, to make sure that I didn't have some type of vein issues.
Oh.
I know.
You know, I've never known anyone to have this surgery. I don't know if you have read from your support groups, but I've never heard of anyone having it who has not had to meet with a nutritionist and who has not had to have a psych eval.
I haven't either, especially if your insurance is paying for it. These are the requirements, most likely. You also have to have an upper endoscopy to make sure that you are all clear. Mm-hmm. And I feel like sometimes a colonoscopy. I don't know.
You did an upper GI?
I had already had one, so I didn't have to get
from when you did your colonoscopy.
Yeah, so I didn't have to get another one. So they were fine with just getting the report from the GI doctor. And so they saw the rooter to the tutor. Mm-hmm. we were good.
Okay.
But that's also a requirement. Some people also have to get tested for H. pylori.
I could see why.
Just to make sure that you don't have that before going in.
Because that's just going to complicate all your other issues.
Yeah.
And then the surgeon won't know if your side effects or symptoms are coming from H. pylori or from the actual surgery.
Exactly. Because if you do have H. pylori, you're going to have to get that cleared up before you have the surgery. I guess my surgeon said, we don't care if you have H. pylori or not. We're just going to, I mean, I don't have any symptoms, but they didn't even send me to get a test, which I didn't want to go through that anyway, because
you've watched me multiple times.
Yeah. And if I did have it, just leave it. Okay? Leave me out of it. Because
you also watched me be near death.
Right.
But you could have taken amoxicillin, which would have made it so much easier for you.
Oh, sure. Okay. So, any other requirements that your insurance has, I wouldn't know about it because I'm just going up based off of what my insurance required, which is the psych eval, the EGD, the nutritionist appointments, and then the consultation, whatever the surgeon requires of you.
Okay.
And then they schedule you out for the 3 months, and you go in and you have your surgery.
Did you have a lot of things change within those 3 months while you were waiting?
What do you mean? Like physically?
Yeah, like weight gain or any issues pop up or...
No, child, but since I knew I was having surgery and I knew I was in that 3-month thing, but I tell you, I was like, let me eat this because I don't know what it'll be like after.
I remember.
And then right before the surgery, I went away. When I tell you, I ate like I never ate before because I just knew, and so I did it big. Like I said. I am so surprised that when my surgeon put the little thing in there, he didn't see a little Jamaican man with dreads said, oh, well, go on. Because when I tell you, like a few weeks before I went for the surgery, I went to Jamaica, I had so much rum punch. That alone.
I'm surprised your liver wasn't fatty on that table.
I'm surprised too, but my liver has been fine for years. But with the food combined with the alcohol, but we're here. Maybe that's why my recovery was bad, because the Jamaican man was trying to get out.
You stupid. The
dreadlocks.
All right. Well, I don't have any more questions for you.
You don't?
No.
I thought you did.
You want more questions? I just had 7.
Oh, okay. I thought one of the questions was
what
has been the best part?
No, because you said that you were gonna address it.
Oh, I thought you were still gonna ask me.
All right. What has been the best part?
Okay. So yes. I know I just asked for you to ask me this question. I can't put my finger on it, but once I will tell you, for anybody that's looking to have this surgery or that has had it and is in the beginning phases, please stay strong, because I would tell you the first 3 to 4 months are really, really hard. They were hard for me because I couldn't eat or drink like I was supposed to. And because of that, I didn't really know where I was, because you need to eat and drink for your brain to function. And my brain was just not functioning because I was malnourished. My vitamin B was low. I wasn't getting in the protein that I need. I definitely wasn't doing any carbs. I was literally living off of 1 piece of string cheese. And so
I'm sorry.
No, at that point I was like, you know what? Like, this is stupid. Like, I literally was.
Weren't you also living off of a piece of like turkey?
Yes, I used to wrap like lunch meat in a piece of cheese.
You was trying to get protein wherever you could.
It was a struggle. I would say after the 4 months, though, once my stomach probably healed and I was able to consume more liquids and protein and my vitamins like I was supposed to, that is when I started to feel better. And that is when I started to not regret it, because a lot of the weight was coming off. A lot of the, I felt more like a human, and I started not to regret things as much.
You weren't rethinking your whole life.
I wasn't rethinking my whole life. I would say buying clothes has been very exciting.
Really?
Because they actually fit the way that I had envisioned them to fit before. and just feeling better in my body. Like getting up from doing something on the ground is not hard.
Mm-hmm.
Walking is not hard. My joints don't hurt as much. I
Because
didn't
you're not
really,
carrying all that weight.
yeah, I didn't really realize how much that extra weight was like holding me back.
Yeah.
I feel like physically, the transformation that I've gone through over the past year, like with the weight loss, and then prior to that with the relationship transformation, um, you don't really realize how much something is weighing you down until it's not anymore.
Mm-hmm.
That's just real talk. Like I didn't realize it.
Yeah.
So now when I'm getting up out of bed, or when I'm getting up from the floor, or when I'm bending down to do something, it's a lot easier. It's just I'm quicker.
Mm-hmm.
Not to say I was super slow before, because I wasn't.
You wasn't.
But it's just like now I'm like, oh, this is what life is like as a normal person. I don't necessarily check to make sure that chairs are not going to break before I sit in them.
You used to do that before?
Absolutely. I'd be like, nah, I can't sit in that chair because it ain't gonna work for me. So many little things have just changed for me, and I feel good on the inside. I know I have to take vitamins for the rest of my life, but that's something I was doing anyway. I was taking vitamins, but you know.
Which vitamins do you need to take for the rest of your life?
I gotta take a multivitamin. I can supplement with additional. So I take a multivitamin. I take calcium. That's a calcium with D3 and magnesium. I think it has zinc in there too.
So is the reason why you got to take this is because after the surgery, these vitamins are not absorbed as well?
Yep, because you can't eat as much. You can't get these vitamins from your diet like you typically would, because you can't eat as much. So you're not going to get what you need. So you have to supplement with vitamins, or you should. Anyone that has had this surgery, this one, especially the gastric bypass, because that really, really depletes you, or you don't absorb as much. Anyone that doesn't take their vitamins is not doing this right. I'm telling you right now, because it's going to show up in your blood work, and you're going to feel it. Whether that's through you feeling weak, or whether that's through you feeling, through
like
you losing your
too.
bones,
Yeah,
breaking bones, or your teeth falling out, or your hair falling out. Now, luckily, I mean, I feel like with my hair, it's been the usual shedding, but I keep my hair in protective styles for the most part anyway. But recently I've had it out, and it was shedding a bit, but I'm just wondering if that's because I had it out and I was combing it.
So nothing crazy.
Nothing crazy, but I've seen people say like they just get bald.
Yeah.
I haven't had that. So I've been trying to keep up with my vitamins. Early on, I was doing collagen. I had to stop that, but you do have to stay on top of your vitamins. It's made me way more conscious of the food that I put in my body, how much of it I'm consuming. I still weigh my protein out so that I know how much I'm getting. I know what I can tolerate now, so I don't track my food as much, but I can. And it's just made me a little bit more in tune with my body. Not even a little bit, a lot more.
Is there anything that you still can't eat?
I still really can't have anything with like a lot of fat. I think that's partially because I also don't have a gallbladder.
So you couldn't take a spoonful of like baked ziti?
Nah, I could do that.
So like, what's something with a lot of fat that you can't eat?
I don't know.
Let me find you to eat everything.
Because I damn sure had a Big Mac the other day.
You did?
I did. I mean, I can't eat it all at once.
Did you try the chicken Big Mac yet?
No.
Oh. Okay. We're gonna leave the beef from McDonald's alone for now, though, right?
We are, even though it's just a quarter pound of beef, but we're gonna leave it all alone. I'm not fooling with that, y'all. I don't eat E. coli.
Yeah. Okay.
So I would say the confidence that it has given me all around has been excellent. I had in talking about this with Jamie beforehand, and like my decision to even get the surgery was hard. I had pushed it back actually a month because I was supposed to have it in August, and then I was taking care of my mom because she had surgery and I was just tired. So I was like, I need to push it to September. and I was actually trying to see if I could just get Ozempic real quick before that, because
I remember.
I could have changed my mind right up until the day.
You was trying to get a connect.
Yeah,
for Ozempic,
but that didn't work. And so I'm fine. But one of the things we talked about is just all of the limiting factors that we as women have to deal with, right? One being a woman, and then two being a Black woman, and then for me being a dark skinned Black woman, which people say that doesn't matter, but it does, sweetie. It does. Okay, people even within our own race are colorist. But then I just wanted to remove one of those factors that I've just been contending with my whole life, which
and
is
you can't remove your skin color. You can't remove that you're a woman, but you could remove your weight.
I could, and so it's been interesting to see the difference in treatment across the board when it comes to work, just going out running errands, dating, just in general. It's been interesting, and we could do a whole episode on that too, because for those that are in relationships when they have this surgery, oftentimes those who are married get divorced, and those who are in a committed relationship somehow end up not being in that anymore for multiple reasons, right? It could either be that the person that had the surgery feels more confident, and so they feel like, F you, I'm out. Mm-hmm. So they're not putting up with a lot of the things that they would have put up with when their self-esteem was lower.
The skinny me not putting up with the shit that the fat me put up with.
Or it could be that the partner is now self-conscious and is not used to their partner getting the attention that they're getting now that they are smaller. Right. I didn't have to worry about any of that because I wasn't in a relationship. I just had to worry about myself.
Yeah, which made it a lot easier.
Made it out so much easier.
You don't have to care about anybody's feelings but your kids, but
yeah,
you don't have to care about nobody's feelings.
Yeah, didn't have to care about it. But one thing I have had to deal with are comments from family, because I didn't necessarily tell everybody that I didn't really tell anyone that I was having surgery. And comments from people in general. It really does.
Like, oh wow, you look so good.
Yeah. And I needed to not that I needed to, but I will let everybody know this right now. Since I have been big all my life, okay, I've always made sure, this is just something that my mom has taught me, that my hair was always done, my nails were always done, I always looked presentable, right? Like, that's just something that I grew up with, and so I never had an issue, and I'm pretty, so I didn't have an issue. But now being in a smaller body, that's just really the only thing, because everything else was
still the same.
Yeah, like my teeth are still the same, my face is still the same, my hair.
You're still well kept.
Yeah, and that
Nothing
will
changed but your weight.
Yeah, that will be regardless of how much I weigh. Like, I'm always gonna be fly. So thank you. Now it's just even worse. So guys, it's worse there.
I can't with you.
It is worse.
What I was telling Jasmine though is from me being on the semi outside, because I'm on the inside, but I'm still on the outside because I don't know. I mean, I know her struggles, but I don't know it personally because I have not gone through them. But what I was telling her is, what I've gotten to witness is she seems to be so much more happier. She seems to love herself even more than she did before. She seems to just like love life. And I told her, not only did she like shed stuff on the inside, but dealing with her divorce and like selling your old house, buying your new house for you and your kids. Like, I just feel like she's a whole new person, and I'm here to like witness it. I love it. And she's just in a happier place. She's in a happier place. And I'm really happy that you chose this weight loss surgery, because I got to see you like transform even more than from when you got divorced. Like, can't nobody mess with you.
You can't tell me nothing.
No, I love it.
Interesting to hear you say, because like I told you guys, before you have this surgery, you may tell people, you may not. But Kim was definitely one of the people that I told, and she's like, I don't want you to have the surgery.
I did.
And then the aunt was like, girl, let's do this
I did
something else.
I was afraid for so many different reasons.
Yeah.
So many different
Yeah.
reasons. I was like, okay, you've tried 116 other things, but didn't you try this one thing right here?
She's like, but did you do this for like a year? And I'm like,
really didn't.
yes.
I really didn't. And then after she had surgery, I came over to visit you and Jamie, and how she was just so weak and stuff. I was like, God, please get her through this, because please, like, I did not want you to have the surgery. No. But now that I'm looking back on this whole year, I'm so glad that you had the surgery.
See? Because I'm thinking to myself, like, I'm not going to say exactly what I weighed, because that's
nobody's business.
Right. But I will say that even when the nurse came to do the IV, she's like, well, what kind of surgery did you have? And I was like, bariatric. She's like, why?
You were a little bariatric person.
I'm like, because bitch, I was big. I need to unbig my back. Worry about yourself. Okay. I think because I'm tall, I carry the weight better.
You did.
And so I didn't necessarily look.
You didn't look big. What you weighed, because you didn't tell me what you weighed
until the day
of surgery, when I FaceTimed you before you went in.
Yeah.
And you was like, girl, this is how much I weigh. And I was in a state of shock.
Yeah.
I did not believe it, because she didn't look like she weighed that.
Yeah.
You did not look like you weighed that. And before your surgery, I never once looked at you and been like, oh, this girl needs bariatric surgery. But now Jasmine sends me before and after pictures, and I'm like, oh my God, you were that big? Like,
yeah, so like this is one. So I don't know. Can y'all see it? Oh, no, it's not that clear.
Maybe get closer to the lens. There we go. Y'all don't gotta see her face, but body types.
Right. Well, I also had a breast reduction
and that's another thing. Once you got rid of them big old bitties, I really felt like you did not look that size, because her boobs used to be out here.
Yeah, they were really big. And you're right, it helped, but then they pretty much came back, because remember when I went to the place and the lady was like, "You're a triple Z," and I was like,
"Great." You said a triple Z.
I was like, "What was the point of that?" But yeah, now I'm down to nubs.
A triple Z.
So yeah, there you will get a lot of people close to you telling you like, oh, you don't need it, or maybe what have you, but only you know what's best for you, right? Yeah. So you got to stick to your guns. You have to understand your body and what you've tried. And if you really want to feel like this is the last resort, then do it. Go for it. You know, do your research on who your surgeon is going to be, their infection rates, try to get
success rates.
Try to get some people that, have had the surgery done by them, if you can talk to them too. One of the things that my insurance required was that I went to a bariatric surgery, surgical
support
excellence
thing, right?
No.
Didn't you go and meet with some people?
I did, but they didn't require me. That. They made sure that whoever was doing my surgery was under a center of excellence. So that means they have to go through this accreditation.
Did they have to be board certified too?
Well, yeah, to be part of that. So I had to go to someone that was reputable anyway. But the person I went to is popular in this area of New Jersey. They do a lot of the surgeries. They just have been doing them. So you want to do your research, of course. A lot of people do go to like Mexico for the surgery too.
I wouldn't do that. Especially by how you were hanging by a thread. Are you supposed to call your doctor
in Mexico
in Isla Mujeres and be like, I need IV therapy? Like, how are they supposed to get you IV therapy here? I'm not messing with them.
Yeah, that's true. But
not for this surgery.
If that's what you want to do your research on that too. Make sure you know, just like in our medical tourism episode, we talk about post-op care. Talk to them about get your Google Translate, talk to them about all that and how you would handle needing IV therapy, what your post-op diet is supposed to be, like when you're supposed to move through the phases, and in the event of an emergency, aside from going to the ER, if they partner with any GI or bariatric surgeons in your area, like that would be great. Because I do see, or I have seen a lot of people that go to Mexico, come back, have complications, and then the surgeons here won't touch them because they didn't do it.
Yeah,
they don't want to work on work that they didn't do.
Unless it's something that has to be removed emergently. Now you pissed because you got butt implants. That got to come out because now you are septic and it's an infection all around the butt implants and it's necrotic.
How we get to butt implants? But I'm
just saying.
Okay.
I'm just saying.
But yeah, you know, if you want more on that, check out our medical tourism episode. But yes. It's the same concept. You want to do your research. And don't listen to these people because half these people just don't want you to be
fabulous.
Right.
Fabulous.
Which is part of the reason why is part of the reason why I didn't tell a lot of people, because it's none of their business.
You can
and
count
I don't
on one hand.
Yeah, I don't need their opinions either. Because they will start to make you feel discouraged about getting it. And then even after. So right now, I have my mom telling me I need to drink an Ensure and calling me crying, saying she's so worried about me because I've lost so much weight that I don't need to lose anymore and I need to gain something back.
So the surgery was a success.
Right. Mm-hmm. Exactly.
Okay. But Jasmine, you don't look sick. I've seen some people from this surgery look sick. Heads all big, bodies all small, and they look very ill. You don't look sick at all. You look
okay. Because I swear to goodness, when Nick and I were in El Salvador, I just kept saying, do I, in every picture he took of me, I was like, do I look like a head? Do I look like a head?
No,
just a head?
You are not giving that bariatric look.
I'm not giving a bobblehead look?
Right. No.
Maybe because, I mean, I do got a big head, but I guess it's, my body fits the head.
Yeah.
Okay. I don't know.
Yeah, you don't look like a bobblehead at all.
All right.
And I don't see a clavicle.
No?
Damn. You want your
clavicle? I mean, it's there. Like, look at it.
Yeah, but it's not like how you showed me that picture when you were pregnant.
Okay.
Yeah.
Okay.
All right, well, we got to go because we got other stuff to do.
No, we got other stuff to do.
We do got other stuff to do.
You're right, we do.
You got
stuff.
You got stuff to do.
I do. All right, guys. Well, if you would like us to do another episode on that, I feel like we could talk about the relationship stuff. I could tell y'all how dating has been post-op.
That's what we need to do.
I know.
Have a topic on dating apps.
I could tell you how.
That's what we need to do.
Relationships have changed post-op.
You got a whole story to tell. I'm not even talking about post-operatively. I'm talking about just in general.
I could go more in depth about the phases and like the eating post-operatively and what I'm doing now, because it's gotten much better. I'm like able to eat everything for the most part, just in moderation. I mean, life is pretty much back to normal, minus a few kinks.
Life is pretty much back to normal, but I feel like life is also really good for you. Yeah. Like normal for you right now is really good.
Yeah. So we can do more episodes. Please comment and let us know. And I just want to say thank you, Kim, for
me.
Yeah, thank you to Kim.
Wait, stop. Say it louder.
Thank you to Kim. Thank you to Jamie for taking care of me after the surgery.
Yeah, Jamie was so good, y'all. If I ever had surgery, I want Jamie to come take care of me.
Yeah, so when I go get my body done, the rest of it, you know, Jamie stay on deck. And then
Jamie was so good.
Thank you to Aunt Lisa too. She was a huge supporter beforehand, and even when I decided to, we spoke and she prayed, and that's when I told you how much I weighed. And checked on me afterwards.
Hey, you got to give a shout out to Boo. Boo was checking on you too.
Boo was checking on me, so shout out to Boo. Checked on me more than some other people who checked on me.
Yeah. He was worried about you.
Yeah. And thank you to everybody who has complimented me too, which is pretty much everybody, because they've seen the transformation. They're like, and I get it. You're not used to me being this size. I'm not either. So I'm still getting used to it too. One other thing I would say for any of you that are on this journey or want to be, make sure you take pictures of yourself. I have so many pictures of myself, like just like in a sports bra and underwear, because sometimes you can't see the changes that you're going through. You just can't. And you'll have to go back and do like a side by side to know that you're making progress. Also, another thing that helped me during this whole journey was not consistently weighing myself like that.
Mm-hmm.
Like I would wait until I went to my doctors every 3 months to really weigh myself. I didn't really weigh myself in between, to be honest, because that gave me anxiety. Like if I would have gotten in the beginning, if I was getting on a scale and I was like 1 or 2, 3 pounds up, or I didn't lose anything, I'd be like, oh, this ain't working. So I just stopped doing it. So
yeah, that's good advice.
Yeah.
All right, guys. I hope you enjoyed the episode. Tune in next time for more snitching.
Yeah.